Thank you for joining us today for today's subcommittee hearing, Overcoming Barriers to More Efficient and Effective VA Staffing. Joining on our first panel, Dr. Nicole Salvo, member and employee of the American Podiatric Medical Association. Dr. Salvo, you're...
Chairman Benishek, Ranking Member Brownlee, and members of the subcommittee, I welcome and appreciate the opportunity to testify on behalf of the American Podiatric Medical Association. I commend this subcommittee for its focus to assist and direct the Veterans Administration to effectively and efficiently recruit and retain qualified medical professionals and improve access to quality health care in the VA. I am Dr. Nicole Salvo, member and director of Young Physicians at APMA. I am also a practicing podiatrist maintaining a without compensation VA appointment. I am before you today representing APMA and the podiatric medical profession. While I do not represent VA, I do bring with me firsthand experience and knowledge of hiring practices within VA and knowledge of the widespread disparity between podiatric physicians and other VA physicians. Mr. Chairman, when the VA's qualification standards for podiatry were adopted in 1976, I was not yet born. Podiatry starkly contrasted with that of physician providers at the time and is a far cry from podiatric medicine as it is today. Unlike 39 years ago, current podiatric medical school curriculum is vastly expanded in medicine, surgery, and patient encounters. Back then, residencies were few and were not required. Today, there are mandated, standardized, comprehensive 3-year medicine and surgery residencies to satisfy all of our graduates, with 77 positions housed within the VA, each requiring completion of a broad curriculum equitable to medical and osteopathic residency training. Today's podiatrists are appointed as medical staff at the vast majority of hospitals, and many serve in leadership roles within those institutions. Many of my colleagues have full admitting privileges and are responsible for emergency and trauma call. The competency, skill, and scope of today's podiatric physicians have certainly grown from the podiatrists that practiced before I was born. Because of this, CMS recognizes today's podiatrists as physicians, and TRICARE recognizes us as licensed independent practitioners. That's today's podiatrist. We must also understand today's veteran. Veteran patients, often plagued by socioeconomic and psychosocial issues, are ailing, have more comorbid disease, and are disproportionately poor health status compared to their non-veteran counterparts. These patients increase the burden of diabetic foot ulcers and amputations, and as documented in my written testimony, almost 2 million veterans are at risk of amputation with underlying diabetes, sensory neuropathy, and non-healing foot ulcers. This is my patient population. The veteran population is far more complex to treat than patients in the private sector as a whole. One of our major missions is amputation prevention and limb salvage, which provides a cost savings to VA and an integral role of the veteran quality of life. As part of the interdisciplinary team, podiatrists independently manage patients within our respective state scope of practice, and we assume the same clinical, surgical, and administrative responsibilities as any other unsupervised medical and surgical specialty. Despite this equality and work responsibility, there exists a marked disparity in pay and recognition of podiatrists as physicians in the VA. The majority of new podiatric hires have minimal experience and lack board certification. The majority of these new hires will separate from the VA within 5 years. I am speaking to you from personal experience as I am one of the majority. I entered the VA without board certification with less than 5 years of experience. I gained my experience, earned my board certification, and then separated from the VA to take a leadership position with my parent organization. While I will forever remain loyal to the veterans, which is why I still voluntarily treat patients at my local facility without compensation, I testify to the profound disparity. Legislative proposals to amend Title 38 to include podiatric physicians and surgeons and the physician and dentist pay band have been submitted by the Director of Podiatry Services annually for the last 10 years, and these proposals have been denied every single year, as were several requests for an internal fix despite written letters of support from the former Undersecretary of Health, Robert Petzel, MD. 5 years ago, APMA leadership made this issue a top priority. Since then, we have alerted the VA to our knowledge of this issue, and in response, former Undersecretary Petzel created a working group with whom we have participated in several meetings and from whom we recently received acknowledgement of the need of a legislative solution to address this issue. In closing, I would like to state that oftentimes we find that the simplest solution is the best. I come before this committee today to respectfully request that Congress help the VA and its patients by passing legislation to recognize podiatric physicians and surgeons in the physician and dentist pay band. We believe that simply changing the law to recognize podiatry, both for the advancements that we have made to our profession and for the contributions that we make in the delivery of lower extremity care for our veteran population, will resolve recruitment and retention problems for the VA and our veterans. Mr. Chairman and members of the subcommittee, thank you again for this opportunity. This concludes my testimony, and I'm available for questions.
Thank you, Dr. Salvo. I appreciate it. Dr. DeSalvo, you mentioned the podiatrist problem in the VA, and it happened at the VA that I worked at. The podiatrist was one of the busiest providers in the surgery clinic. I mean, they had a hard time keeping the podiatrist there long enough to do all the work he had to do. What's the difference in the payment? They're not paid as physicians then? Or tell me, can you explain that to me a little bit more?
Podiatry is on a different pay scale. Unofficially, I am aware that the pay scale ranges anywhere from $60,000 to $100,000 less from other VA medical and surgical specialties, depending on what the specialty is.
Well, that would sort of explain why it's difficult to recruit. Right. Mr. Silva.
Well, Dr. Salvo, I'd like you to weigh in as well, if you can.
Thank you.
Thank you.
I'm in complete agreement with
Nice
Dr.
to meet
Spagnuolo, and he indicated earlier in his testimony an approximate wait time in terms of getting credentialed and privileged and starting in the VA approximately 1 year. And that is certainly, if I were to consider the average, that is probably true. When I left my post in the Cleveland system, it was 14 months before that was filled. I have had 2 WOC positions since I have started my current position with APMA. One took me 11 months. The other one, surprisingly, took me 5. It is an excessive, burdensome process when you factor in VetPro and you factor in the application process alone with all of the forms and the various HR levels and committees that everything has to be completed. So it is extremely excessively burdensome.
Thank you very much for your testimony, and I yield back.